Hi, it's Chris Sear, Chief Medical Officer for Telecare. The pandemic has taught us that telehealth is here to stay. Today, I'd like to go through some best practice guidelines to help you optimize your telehealth consultations. Firstly, confirm in your own mind that the patient's case is suitable for telehealth. Take into consideration the location of the patient and their access to in-person care. Telehealth may be justified if alternative inpatient care is prohibited by physical disability, costs, long waiting times, or their geographic location. Consider the nature of the referral itself. Sometimes conditions require a physical examination and are not telehealth appropriate. Consider whether having a GP or a junior doctor facilitated consultation to examine the patient may be appropriate. Make sure you're centered and the camera is at eye level. If using two screens, ensure the camera is aligned with the screen you'll be looking at most. When using a laptop with a camera at the top of the screen, I like to position my extra monitor directly above my laptop so I can still look at both screens and be looking in the direction of the patient. I find it's preferable to side-by-side screens as it allows better eye contact and avoids the need to turn my head away from the patient. Ensure you're in a quiet room and place a sign on the door to let others know you're in a video call. If working from home, ensure your door is locked and errant children and animals do not enter the screen. Not only is this distracting and unprofessional, it could also be a breach of patient privacy. Avoid visual distractions such as inappropriate backgrounds, glaring lights, and inappropriate clothing. Remember, even though it is a telehealth consultation, professional attire is still important and patients do still expect your dress is appropriate. Ensure there's adequate direct lighting in the rooms so no shadows are cast on your face. Your face should be close enough that the patient can see your facial expressions, but leave room around the top and sides of your face. Firstly, introduce yourself and confirm the patient can adequately see and hear you. Confirm the patient's identity and the identity of anyone else in the room. Check the patient is in a private space and reassure the patient that the telehealth platform is secure and the information is safe. Confirm consent for the consultation to happen via telehealth. If bulk billing, ensure the patient consents to be bulk billed and document this in your notes. Please note, Telecare establishes informed financial consent before all appointments. Establishing rapport via telehealth is more difficult. Consider commencing the consultation by taking a social history or asking a non-medical question. Try to maintain eye contact by looking at the camera and avoid frequently looking away to other screens where possible. It may be helpful to reassure the patient that at times you may be looking away from the camera to look at another screen, but you're always listening at all times. Try to reinforce to the patient that you're actively listening with frequent head nodding and other non-verbal cues. Summarizing the issues discussed and confirming the patient believes this to be a good summary, or asking the patient to summarize the issues themselves, are good ways to build rapport and ensure accurate communication. At the end of the consultation, ask the patient if they have any questions or concerns. Ensure the patient understands how pathology and radiology forms and scripts will be transmitted to them. For example, does the patient prefer post or email? You are able to send emails with pathology and radiology request forms directly to the patient from a no-reply email. If writing scripts, will it be posted? Will you use e-scripts? Or will you email their local pharmacy, then post the original? We strongly suggest that you don't ask GPs to write scripts or test requests for you. One exception may be if the GP is present in the consultation and happy to do so. Ensure your patients know the process for payment and rebooking. For Telecare, the patients do not need to call reception afterwards, as their payment will be taken from pre-collected credit card details. They will be sent an invoice and all patients have been pre-consented with regards to the costs. They will be sent a link to self-book their review appointment, and if they don't respond, the telecare staff will contact them. Other clinics may use different processes, and make sure your patient is aware of your clinic's workflow. If bulk billing, it's important to document that the patient has consented to be bulk billed, and for the benefits to be paid directly to the practitioner. Prior to the COVID pandemic, a DB4 form was required to be filled out by the patient, granting permission for Medicare rebates to be given directly to the doctor. The provision to replace the DB4 form with documentation in the clinical notes is a temporary measure available until the end of December 2022. For time-based item numbers, only patient-facing time when video and audio link is maintained counts. Ensure consultation times are documented when billing time-based item numbers. Thanks for listening, and I hope this summary and guideline review has been worthwhile and helps to improve the quality of your telehealth consultations.